Further treatment in bronchiectasis include self-management plan. Patients need an individual plan for exacerbation, which usually involves having a supply of home antibiotics. Treatment of associated airflow obstruction or wheezes with inhaled steroids and or bronchodilators if there is an additional disease process causing this, such as bronchiectasis in the context of asthma or COPD. There is no indication for inhaled steroids in isolated bronchiectasis. This is also applies to oral steroids, leukotriene receptor antagonist, phosphodiesterase type 4 inhibitors, and methylxanthines. There is no specific treatment for abnormalities of mucociliary function, although beta-2 agonists may enhance airway clearance. Nebulized hypertonic saline 7% may aid sputum clearance, although bronchospasm may limit its use. Acetylcysteine may reduce sputum viscosity. And annual influenza and pneumococcal vaccinations also documented. Osteoporosis prophylaxis, if there is long-term steroids, should be considered. Reflux treatment, if aspiration, also considered. Associated rhinosinusitis is seen in up to 70%. We will treat with nasal steroid and the consideration of antibiotics if infection is likely. Nutrition. Treat weight loss or low body mass index aggressively, as this is associated with a poorer prognosis. Immunoglobulin replacement therapy in patients with immunoglobulin deficiency, and those patients with immunoglobulin deficiency should be referred to an immunologist for further assessment. Oxygen for those with ventilatory failure is very important. Non-invasive ventilation and hypercapnic ventilatory failure due to end-stage disease may need long-term nocturnal NIV, and this can also be used as a bridge to lung transplantation. Rule of surgery. This is the only potential curative treatment, with resection of a single chronically infected lobe occasionally being of benefit. It's much less commonly needed now, as the incidence of a single lobe disease related to previous severe childhood pneumonia is falling. In some cases, bronchiectasis can recur at a later date in other lobes. Transplantation. Most commonly performed for cystic fibrosis bronchiectasis, but referral may be warranted for severe non-cystic fibrosis related disease. Nebulized DNase or Dornase alpha. Evidence indicates this may be harmful in non-cystic fibrosis bronchiectasis and not recommended.